In a week that marked International Women's Day, there's one Kiwi woman who's got more reason than many to celebrate. Distinguished Professor Dame Margaret Brimble and her team made a molecule 20 years ago that's turned into a breakthrough drug.
It's on the cusp of being approved for public use in the US. If it does, Dame Margaret will make history in more ways than one.
A few days' wait is nothing when the journey to get here has taken more than 20 years. Distinguished Professor Dame Margaret Brimble is just a couple of sleeps away from knowing if her drug can help thousands who suffer from Rett syndrome. It's a debilitating disease that affects mainly women, developing in babies from 6 to 18 months old. Symptoms are similar to autism and cerebral palsy, with a loss of motor control and communication skills. It affects about 1 in 12,000 girls. There's no approved treatment, but that could be about to change. And for more on this, we're joined by Distinguished Professor Dame Margaret Brimble. Thank you so much for your time, Dame Margaret, and congratulations. How big is this?
This is huge. So you work your whole life as a medicinal chemist thinking that one day you might make a drug that could go into human clinical trials. That's big enough. But to actually have it go through all those trials, right through phase 1, phase 2, phase 3, and be on the brink of approval to be used in patients is huge. I never dreamed this would ever happen.
So 20 years ago, Dame Margaret, did you imagine this day?
No, so 20 years ago here in this very lab, we made a molecule that we called NNZ-2566 that the World Health Organization then called trofinetide. And it was developed and just was made for traumatic brain injury, but trialled in Rett syndrome, went through very robust clinical trials, and finally we're at the stage where the FDA hopefully will approve it on March the 12th, hopefully.
And I understand there's something particularly special about the research team too.
Yeah, so it's a female academic laboratory, and I don't think any female academic lab has produced a drug that's ended up getting FDA approval. So that's huge, and it's a drug for females. What more could you want?
Dame Margaret, specifically, what will it mean to those who suffer from Rett syndrome?
So Rett syndrome, girls born to get to about 18 months, 2 years old, and then they lose their cognitive function, all their motor function, they can't talk, it's fed by straw. There's nothing you can do for them. There's no treatment, there's no magic bullet, no magic pill that they can take. All you can do is try and care for them as best you can. But now there's a chance, there's this treatment that will actually try and reverse those symptoms. And in the clinical trials, I know one patient in the United States, Caitlin Lancaster and her mother, her daughter, this girl, Caitlin, was on the clinical phase 2 clinical trial, and she started to talk. So her mother, Melinda, just can't wait to get the drug approved to be able to give it to her daughter. So there's a whole lot of patients out there that are just waiting to get that final approval.
And as you mentioned, FDA approval is expected on March the 12th. I don't want to jinx things, but how do you intend to spend the day?
I'm hoping just to go about life as normal. It's a bit like waiting for exam results. And, you know, if we just hope we get that word approved. Approved is all we want.
I'm sure you will, and I'm sure someone close to the team will put a little bottle or two on ice. Congratulations again, Dame Margaret. All the best.
Thank you very much.